This video is going to discuss something a bit unusual. However, it's something that needs to be discussed, and that is hair transplant frauds, scams, illegal and unethical activities, of course occurring within a doctor's office who performs hair transplant surgery. The reason why I'm taking the time to mention this is because patients should be aware of this. It's kind of rampant to some degree, and I think that if a patient is informed and understands certain things, they would not get caught up in these situations, right? So let's talk about 8 major, now I don't categorize them as all as fraudulent or as a scam or illegal and so forth, but they do have their own category. But I'm just going to mention 8 major problems within the industry that you should be aware of. Number 1. Now, in the state of Florida, I cannot tell you the law in other states, but if a doctor advertises a free consultation, now that could be any doctor. Could be myself, could be a doctor. This is any doctor in any field. Now I know we're talking about hair transplant surgery. We're just going to focus on that. But in essence, I believe it crosses all boundaries. But we're just going to focus on hair restoration surgery and surgeons. Now, if a doctor offers a free consultation, right? Let's say you're the patient, you come in for a free consultation, and the doctor or their assistant or whoever says, hey, why don't we book you a surgery right now? Okay, and you think it's a good deal, he's giving you a good price, or whatever the case is, and you sign on a dotted line and you give him money and you book a surgery, okay? And then you go through with it, right? You have that surgery. I want you to be aware that according to the Florida statutes and Florida law, that any doctor who offers a free consultation and actually schedules and books a procedure on the very same day, like during the consultation like I discussed, that procedure must be given for free as well. So what does that mean? If you had, for example, a hair transplant scheduled and there was money transfer on the same day or same time frame closely related to that free consultation, you are entitled to all that money back, because the statute states that if a doctor is offering a free consultation, whatever is offered during that consultation must be free as well. Now again, we're kind of focusing on hair restoration surgery. I'm not going to go across the board with any other doctors, like we're not talking about dentists or podiatrists or any other type of doctors or procedures. We're going to stay focused on this subject because, again, I believe it's a rampant issue and problem. This affects me and my field, and I want patients to understand that since I'm involved with hair restoration, if I offered a free consultation, you'll get a free consultation, but there will be no booking of surgery or anything that day, because what I do anyway is I need to review the records. I need to do several things before we rush into a procedure. Okay, that's just what happens here in my office. Now, let's move to number 2. When you go into your consultation and you feel like you're pressured, okay, we call it the high pressure sale, okay, beware of that, and I'll tell you why. Usually, the doctor will have a very beautiful woman, let's say, talking to you. It won't be the doctor because he's generally not so good looking, right? And so he doesn't put the pressure on you, but they get a nice, beautiful looking woman doing your consultation, maybe telling you how beautiful you would look after you get your hair transplant and so forth. But there are certain words used to kind of push you further along into signing right on the dotted line right there, okay? And don't fall for that. Take time. You might want to consult a few doctors because they know that if you, let's say you went to Dr. A and he He's putting the high pressure sale on you. See, that doctor knows you might go to Dr. B, C, and D, and you might wind up somewhere else. Okay? Rightfully so, because you might like this other doctor better, you see. And they try to limit that activity, okay, your activity in exploring and searching for other doctors in consultation, okay? So never, if it's a high-pressure situation, and they force you kind of indirectly to say, hey, let's make a deal, don't do it, okay? Just simply don't do it. Take a day or two to think about it. There's nothing wrong with that, okay? Because this is it's a lifelong issue. After the transplant is done, this is something you live with, right? So what's another day or two to think about it? The third issue, so moving on, I call the bait and switch. Okay. Now a lot of doctors will offer the FUE procedure, for example, the follicular unit extraction procedure, but they'll also offer a strip procedure, okay, where they take a strip of skin out of the back, they take that strip of skin and they dissect it down into small grafts, and of course they put it in. The FUE procedure generally is each graft is taken out individually by the doctor, okay, which is much more labor intense for the doctor, much more difficult to do, much more challenging. Now, why I say bait and switch is this. These are my terms, and I use them. Hopefully you'll understand exactly how I'm using it. Like for example, let's talk about the FUE strip bait and switch situation, where if you notice, if you want an FUE procedure, the price is way, way high, but the strip procedure is very, very low. The cost is not bad at all, right? You'd say, wow, after hearing that FUE, follicular unit extraction cost, gee, I'd rather do the strip method, right? Well, I think that's somewhat unfortunate that the discrepancy in cost is there, that you would have to pay so much more for a superior. It is a superior procedure, yes. It is more intense on the doctor, yes. However, you'll notice that a strip procedure for the doctors, well, I'm telling you, you wouldn't know this. This is what, from my experience, a strip procedure for the doctor is so much easier to do. And they would rather not, in most cases, do an FUE procedure because of the expertise, technical expertise and dexterity with your hands needed to perform such a procedure. So they're kind of shuffled off into the strip method, right? They'll I would say advertise, say, hey, we do the FUE, we have all this technology and so forth, but you're getting the strip done because of price, for example. Again, I think it's unfair that the disparity in the price is so high. That's my opinion. However, I do not, I work with patients on that and so forth, and I try and do what's better and superior for them, and try and keep within a budgetary boundary that will allow this disparity to be less, you see. So there would be somewhat of a greater interest to do the FUE procedure. But I just want you to be aware that the procedure I use, okay, so which is termed the Lexus procedure, named after me, the Loria excisional unidirectional stereoscopically guided procedure, is difficult to do, but this is what I do because I feel it is best for the patient, and I work with the cost for the patients, okay? Now, moving on, now this is somewhat of a difficulty to figure out, but we call it photographic misrepresentation of hair transplant results. For example, if you go to a website and all of a sudden you see a person there with a full head of hair as though he didn't lose one hair, but it says nothing about him, right? It's just sitting there, right? You have a photo there of a full head of hair with no description. You're saying now, you must be wondering, is that the result of a hair transplant or not? But that looks good though. It captures your eye, you see? And pictures like that should be avoided in general, because patients will misinterpret that as a possible result, you see. I noticed that on many websites, and it's unfortunate, because if you see, again, someone with a full head of hair, you're uncertain. You might say, hey, that's a great result. That's a great hair transplant result. But it doesn't specifically say that. Okay, so it's kind of misleading in a sense, and that you should be aware of. In addition, when it comes to scarring in the back, remember we talked about that strip method in the back? Sometimes a doctor may very well take a photograph of the back of the head when there really is no scar there. In other words, it looks perfect. And you say to yourself, wow, that's a great result. That's a great looking scar, right? Because there's no scar there. Okay, that's deceptive as well. That's difficult for you to figure out, because you would have to now examine the patient's scalp yourself, which, you know, so a lot of patients would not volunteer to do, and if it was possible, I would encourage you to do so, okay? Because when you cut the scalp, you always have a scar. Whether you're doing a strip method, which results in a linear line-like scar, usually thin, but it could be thick as well, depending on how the patient heals. And with the FUE extraction method, even though we're taking little pieces of skin out, tiny little ones, still yet you have a microscopic, tiny little scar. Again, anytime you cut the skin, there's a scar. That's a natural reaction that the body has. That's how it heals, okay? So, photographic misrepresentation, be cautious. So that would be the fourth issue. The fifth issue is this. It's how many grafts do you really need to fulfill your expectations, okay? And often it's kind of not directly, how should I say this, the graft count or graft number is truly not given to you, I feel, in some cases, because if you were told the real amount of grafts, you might say, hey, I don't want to do this because maybe I can't afford it, or you're not ready for it psychologically, or whatever the case may be. So someone might say, hey, you know, I think you need about 900 grafts, all right, to meet your expectation, where you need really 5,900 grafts, you see? So now you're trusting in the doctor to estimate this properly, right? So now you get 900 grafts, then you realize what you're getting, okay? And now you're kind of like, okay, well, we got to continue the process, okay? So now you unfortunately understand at that point in time what you got yourself into. Now, hopefully you don't stay with the same, well, it's your choice, but if you stay with the same doctor, I'd be surprised. Another issue is, I mean, how many procedures you would need. It kind of dovetails in with the number of grafts, right? For example, if I told you you needed 6,000 grafts, right, I might be able to do that over 3 procedures. However, if the doctor says, oh, 1 procedure and we'll fill you up and you'll be fine, most likely, now he'll leave a little room for error there, right? Now that's kind of misleading, I feel, because doctors that have been doing this for a while understand and know. I mean, it's a mathematical formula, really, of how many hairs it takes to look fairly full, right? And for any doctor to say you'll probably need this for certain, or uses any words of certainty, okay, you should be aware of that, because you have to truly extract out of, the doctor has to extract out of your mind what you want to see and translate that into graphs, which then can be translated into numbers of procedures, okay? Most men need more than 1 procedure, and I tell them, all right? And if you needed 1 procedure, most likely I'd tell you for certain you need 1. But if you need 4 procedures, I'm going to tell you that right up front, okay? Or a ballpark. It could be 3, 4, 5, it could be 2. Whatever I feel I can extract and see through your eyes, what you want to see, then I could translate that properly for you, right? So you have to be cautious with that as well.